I'm Dr. Andy here. It is time for today's Facebook Lives, one of my favorite days of the week. While I give all of you a chance to log on and join us today, I'll give you a little bit of a background of who I am. I hope all of you are having a great fall, a great start to your September. I'm here in beautiful sunny Toronto, which is starting to transition into fall. It's getting a little bit cool now, but it's absolutely beautiful. So again, I'll tell you a little bit about my practice while all of you get a chance to log on and join. So I am a naturopathic doctor. I have been practicing for almost 11 years now. Every time I say that, it sounds like an extremely long time. So my focus has always been sort of low-carb keto. I came into the ketogenic lifestyle through my own health issues, my own health concerns, some digestive issues, and I kind of stumbled across keto when I was in my early 20s and progressed from there, and it's something I incorporated as a foundational tool for all of my patients in practice. And I now practice I work in a clinic with about 19 practitioners. All of us function from the low-carb keto standpoint. It's something that we integrate into the foundation of our protocols. I treat a lot of hormonal imbalance, chronic illness, chronic pain, Alzheimer's prevention. We do a lot of neurorehabilitation in our practice as well. And again, the foundation of the majority of those protocols is really a low-carb keto lifestyle, and now exogenous ketones as well, which we have incorporated into that. That's especially helpful. We do a lot of traumatic brain injury and concussion. So that's something that's really been a wonderful tool in our practice. This month, I have to say, I've had a lot of patients who are coming in to sort of reset. It's such a wonderful time of year where people are looking to make really great health changes. So a lot of people coming in as we move into fall who are wanting to make those dietary changes, or they sort of fell off track in the summer, and now they're looking to sort of circle back around and get back on track. So I'm doing a lot of keto, a lot of lifestyle changes, a lot of intermittent fasting, and extended fasting. I actually had a patient just message me yesterday who had done her first sort of extended fast. She did a 5-day fast, and she was messaging me all of her body composition results, telling me the decrease in body fat she had seen, the increase in muscle mass, improvement in body water and hydration. So she's had some really great results with that. So the fasting is my primary intervention tool for people who have fallen off track. So I'm getting a lot of people to engage in the reboot or in that intermittent fasting, and then adding in their exogenous ketones as well. And I find that that's a really great introduction to sort of that reset that people are needing as we move into fall, and we sort of reset after the things that we've enjoyed in the summer. So I see some of your questions starting to come in now, so I'm going to start answering your questions. I will try and answer as many as I can. We have a fantastic event coming up at the end of the month, so if you are going to the Hacking Better event in Louisville, if I don't get to answer all of your questions here, hopefully you'll come and say hello and I can answer your questions in person there as well. So let me get started, and I will try to get to all of them. I know I won't always make it to all of them, but I'll answer what I can afterwards. So the first question I'm getting is about migraines. So the concern is about acidosis. So someone's asking about migraines and they're being told not to follow a ketogenic diet. So I actually find that the ketogenic diet is one of the primary tools that I use when I have someone who suffers from migraines. I think what people often forget when it comes to migraines is really looking at the foundation of what's causing your migraines in general. Often people who have chronic migraines, it's very frequently due to lifestyle and diet. So when I have people with migraines, the very first thing I'm doing is changing their diet, because often it's carbohydrates and dairy that contribute to migraines. So keto is actually one of the first things that I give to people who are suffering from migraines. So I wouldn't be concerned either about acidosis. It's not going to create an overly acidic environment in your body. It's not going to cause or contribute to the migraines. There's also some research looking at the relaxation of, because again, migraines can often be caused from vasoconstriction of blood vessels in the head as well. So there's also some interesting research looking at the relaxation of those vessels, which may also be helpful when it comes to migraines. So again, keto and taking our exogenous ketones. So taking those exogenous ketones is one of those primary things that I actually use when it comes to treating migraines, and prescriptions are not necessarily the first thing. Also with migraines, it's important to remember that often vitamin B2 is deficient. So migraine sufferers are often quite helped when they take about 400 milligrams of vitamin B2 a day. So those are usually the first interventions I would use when it comes to migraine. So absolutely, I would say it's not contraindicated. It's obviously not a guarantee that it's going to help with your migraines, but I absolutely would say give it a try and see if that helps you. So it's not contraindicated and shouldn't make your migraines worse. So the next question, how can you be sure if you're a professional athlete if the product is 100% safe? So this is where it needs to be. If you're a professional athlete, this is where you do have to be careful with supplements, because they do need to be certified specifically for sport for you to be 100% sure. I can tell you that there's nothing in the product that is on the sort of list of prohibited or contraindicated supplements that you need to take. I can tell you that there's nothing in there that's contraindicated that professional athletes shouldn't take. We do have many professional athletes who are taking exogenous ketones, but again, I would say if you're a professional athlete, just you need to check with your coaches and the governing body, make sure that that's safe for you. You can compare that against the list as well. So often there's a list saying it's NSF safe, certified for sport, so you can compare it to that list as well. But again, there aren't any contraindicated ingredients in the products. So do ketones help with Sjogren's? So interesting, I was just treating a Sjogren's patient yesterday as well. So Sjogren's is an autoimmune disease. It's an autoimmune condition that can cause a lot of chronic pain and joint pain and skin issues as well. So again, I always like to say the first thing it's important to remember is that ketones and exogenous ketones will not cure any medical condition that you are currently experiencing. So I like to say that first. If you are suffering from a medical condition, you have to work with your healthcare provider and make sure that they have said that it's safe for you. However, when it does come to autoimmune condition, one of the first things I'm doing for autoimmune is actually having my patients, again, follow a keto lifestyle and taking their exogenous ketones. That's one of the most important things. We know that most people will say we don't know why an autoimmune condition has started, what has caused your autoimmune condition. And what I usually see in practice is there's often an underlying stressful event that has contributed or led to the development of that autoimmune condition. So often people can say there was an illness or a high stress or something like that that preceded the onset of their symptoms or the diagnosis of autoimmune. And when we start digging into autoimmune conditions a little bit more, we see that there are underlying factors that contribute to the development of that autoimmune condition. So we know that we see mitochondrial dysfunction, we see inflammation as a foundation of autoimmune conditions, and we see changes in BDNF. And these are the same things with anyone who has, Hashimoto's or MS or multiple sclerosis, chronic fatigue. We also see those underlying those conditions as well. And the research has been really interesting in this space, showing that exogenous ketones or the ketogenic diet, so beta hydroxybutyrate essentially, has actually been shown to improve mitochondrial function. So again, underlying that autoimmune condition is a dysfunction of the mitochondria. The mitochondria is the powerhouse or the generator of the cell or of the body. So we need our mitochondria to be functioning properly in order to adequately create energy. And we know that beta hydroxybutyrate improves mitochondrial function. It also improves the production of something called glutathione, which is one of our most important antioxidants. And the interesting thing about antioxidants is that's what we need to combat the result or the impact of stress. So when we have chronic stress, we create these things called free radicals. And so when you hear people talk about your antioxidants or resveratrol or drink your red wine for your resveratrol, what they're wanting are those antioxidants, because those antioxidants bind those free radicals which move around the body and cause damage to our cells and to our genes. And so glutathione specifically is a very powerful antioxidant that can help bind some of those antioxidants. So beta hydroxybutyrate, BHB, actually encourages the production of this antioxidant, and we know that those free radicals that are caused from stress are also implicated in aging. That's really the theory or the foundation of aging, is that we're producing all these free radicals, we're causing free radical damage in our body, and then that's also underlying autoimmune conditions. So beta hydroxybutyrate is improving the production of these antioxidants that help to bind some of those free radicals. So we see the improvement in glutathione, we see improvement in mitochondrial function. Interestingly, mitochondria also uses glutathione to function properly. So we have two sort of overlapping functions there. And then we also see a change in BDNF. So BDNF is called a brain-derived neurotrophic factor, so BDNF, and it's a protein in the brain that's actually responsible for making new neuronal connections. But we also see low BDNF in autoimmune conditions. We also see that in cognitive decline or Alzheimer's. And so what the most important thing is that we upregulate this protein that we have in the brain. And what we have found is that beta hydroxybutyrate or BHB can actually upregulate, it'll actually upregulate this protein called BDNF. And the other thing that does that quite well is fasting. So the two best things that to join together are taking the beta hydroxybutyrate and then pairing that with fasting. So intermittent fasting in the reboot. So I'll often have my patients engage in intermittent fasting during the week, sort of that 16-hour fast from dinner until their first meal the next day. And then from that point, I have them once a month do an extended reboot. So shorter fasting in the week. Once a week, I have them do a 24-hour fast, and then once a month, I have them do a reboot. And so we're upregulating BDNF, we're getting a lot of those antioxidants, optimizing mitochondrial function. So in terms of what underlies our autoimmune condition, there could be great benefit there. But again, you have to work with your healthcare provider, make sure that they say it's safe for you. So the next question I have is about traumatic brain injury. So we work with a lot of traumatic brain injury, a lot of professional athletes as well. And there's some really interesting research looking at traumatic brain injury and what happens to the brain, so concussions and things like that. So the traumatic brain injury, what we know when it comes to the brain function being impaired, so we not only see that in concussion, we also see that in cognitive decline and in Alzheimer's. So the brain is used to functioning on glucose. And that's mostly because we haven't given the brain other sources of fuel. In the past, unless you were ketogenic, you weren't making ketones. So really the only available fuel source for the brain was glucose. But when you have a cognitive impairment, traumatic brain injury, what we find is that the brain can't actually efficiently use glucose. So the energy metabolism in the brain when it comes to glucose is impaired. But what is not impaired is ketone metabolism. So the brain can't use, what the brain cannot use is glucose, but it can still use ketones. So there's some really interesting research looking at the role of beta hydroxybutyrate, and in this sense, it's more so with a traumatic brain injury, it's more so with supplementation, so exogenous ketones, because obviously if you've had a traumatic brain injury, it takes time to become ketogenic. So we're looking at administering ketones and how that can help prevent post-concussion syndrome, and how it can also optimize brain function. So there are also studies looking at the role of BHB in Alzheimer's and cognitive decline in humans and in animals, and we've seen benefit in both of those as well. So there really could be benefit when it comes to brain function and optimizing that fuel source. The question, do the Signal OS pills contain ketones? No, they don't. They can be used without other ketone products or any of the other ketone packs. Essentially what we're doing with the Signal OS is optimizing the function, the effect, the benefit of the ketones. So we use them in conjunction with the ketones, but no, they don't contain BHB in and of themselves. So can exogenous ketones help with an MTHFR genetic mutation? So how to explain that in quick terms for people who aren't familiar with what that is. So essentially we have a process in the body called methylation. Methylation is something that occurs when our body is trying to, for example, neutralize harmful particles or detoxify. I use the explanation of how we methylate hormones. So for when we break down our estrogen, for example, it needs to be methylated, which means we have to attach this little carbon group onto it to make it less harmful and then eliminate. And so some people have genetic defects in this methylation process. And so those individuals who have defects in methylation, I find those people have really they have great difficulty detoxifying. Those are a lot of my patients who have chronic mold toxicity. I see that in my in my Lyme patients who are very symptomatic. They have really poor methylation, very poor detoxification. Women who are estrogen dominant and have a lot of issues with their cycles or PCOS, PMS, they also have a lot of methylation issues. So the question is, would exogenous ketones help or assist with that genetic mutation? And I haven't seen any research at this point that would show that beta hydroxybutyrate would assist with that genetic mutation specifically. When it actually comes down to methylation, there's so much more than just that one MTHFR gene. We actually test 7 genes in that whole methylation process. It's more than just that one. And then often what you're needing to optimize you have to figure out, do you need folinic acid or folic acid? Do you need methyl or hydroxyl B12? So there are different things that you need to give your body based on the type of mutation that you have. So at this point, I haven't seen any research that shows that BHB would improve that specific mutation. Again, we're looking at things more like the folinic acid or the folic acid. We're looking at things more of methyl or hydroxyl B12, depending on what that mutation is and which gene of the 7 is actually impaired. So I haven't seen that BHB would impact that specifically. As I mentioned earlier, it could assist with detoxification, given that it helps to improve glutathione, which is one of the most important things that we need for detox. I often find that people with methylation issues also have genetic glutathione defects as well. So I'm often giving them glutathione in conjunction with some of those other things. So improving the glutathione that we get from the BHB can quite often be helpful, but specifically impacting that MTHFR gene mutation specifically, I haven't seen research that it would do that. So that's something we can keep our eyes open for. But again, from a more peripheral standpoint, there could be potential for assistance there as well. So would this help with Down syndrome? So it's an interesting question. I haven't been asked that one before. Again, I don't have any, so I guess it depends in what sense you're looking for the assistance when it comes to Down syndrome. As we know, that's a genetic mutation as well. So when it comes to that genetic impact, no, it's not going to assist in that sense. I don't know if you're looking more for will it assist in sort of day-to-day function or cognitive function or cognitive benefit. At this point, I haven't seen any research specific to Down syndrome. That doesn't mean it doesn't exist. It means at this point I haven't seen any. So I can't say if BHB specifically can help improve sort of day-to-day function. Again, it's not going to change or impact the genetic mutation that contributes to that symptom. But it could potentially assist with, some of the daily functioning, but I haven't seen any research in that space so far. But that's something, now that you mentioned that I will look into and see if there's any research. But I can say at this point it's not going to cause any harm. So it could be something. That you could incorporate to see if it might make a difference. But I can't direct you specifically to any research in that way. So someone is asking about gout and keto. I think you're suggesting for people who currently have gout who are following a ketogenic diet, what do you give them? So usually when it comes to gout or stones or things like that people are concerned about, what I usually suggest is that you really increase your electrolytes. So things like potassium, making sure you're getting your magnesium, getting your potassium or your electrolytes in there as well, that would be really important. Those in general can help prevent the development of kidney stones and may prevent a sort of a flare-up of gout as well. When it comes to taking exogenous ketones, we haven't seen any links between increasing a gout flare-up or anything like that, but I would just make sure to be diligent on those electrolytes. So the Mitoplex, pairing that with your ketones, you can just dump it right in and drink them. You can mix the two together. And then I often suggest with gout and with stones that you add in some additional potassium supplementation and possibly some magnesium supplementation as well. So questions about PCOS. So I do love the hormone questions. I treat a lot of hormone imbalance, a lot of women in practice as well. So I see a lot of women with PCOS. So PCOS stands for polycystic ovarian syndrome. And so essentially what that means is that women are developing cysts. They're developing cysts on both of their ovaries, and then they end up with these women end up with a lot of PMS. They end up with really high male sex hormones, a lot of insulin resistance, irregular cycles, a lot of PMS. So usually PCOS is due to estrogen dominance. So we see that because there's a really high level of estrogen in relation to progesterone. So that's one of the primary causes of PCOS. So often I'm using bioidentical hormones to treat the estrogen dominance, but the other symptoms of PCOS could benefit quite significantly from a ketogenic diet and from exogenous ketones. So the very first thing I'm doing is putting my patients on a ketogenic diet when they have PCOS. Women who have PCOS are more prone to weight gain. They are insulin resistant. What that means when we say insulin resistant, so insulin is what helps to pull sugar out of the blood. So we need to get the sugar out of the blood into a cell, and insulin is kind of like the key. Insulin sort of unlocks that door, allowing the glucose to get into the cell. But when that key stops working or gets a little bit, it struggles a little bit, can't quite open that door to the cell, we call that insulin resistance. And so what the body does is starts to produce more and more insulin. And this is a double-edged sword because insulin is a storage hormone and it tells your body to store fat, specifically around the middle. So women with PCOS end up with really high insulin levels, insulin resistance, and then a lot of weight gain around the middle, which we don't want because that's a lot of the visceral fat, which isn't fat underneath our skin, it's fat that surrounds our organs. So we know that beta-hydroxybutyrate can actually help improve insulin resistance. So that's one of the greatest benefits in women with PCOS because it helps to decrease those high insulin levels. And we also know that they have high male sex hormones. And the beta-hydroxybutyrate has been shown in women specifically with PCOS to decrease those elevated male sex hormones. Interestingly, it doesn't do that in healthy women. And it won't do that in men either. It's not going to decline healthy testosterone levels, but women with PCOS have elevated levels above the normal range, which can cause a lot of significant side effects as well. And so adding in the beta-hydroxybutyrate can help. The studies have shown that actually helps to bring some of those levels down. We also know that some of these women also suffer from irregular cycles. And so often they're not ovulating. There's some animal studies that have shown that administration of beta-hydroxybutyrate can actually encourage ovulation. So that's also really important for women with PCOS who are really concerned about whether they're ovulating or if they're looking to conceive or just to regulate their cycle. So it's been shown to regulate, to encourage or promote ovulation. So when it comes to my PCOS patients, the very first thing I'm doing is putting them on a ketogenic diet and asking them to take exogenous ketones, and then we're treating some of the external things like the progesterone and giving them bioidentical progesterone, treating estrogen dominance. So those are some other things that we're doing to help balance that. But yes, absolutely one of the foundations in that would be to start getting on the ketogenic diet and taking the ketones. And again, I always like to say it's not going to cure or treat any medical condition that you have, but there absolutely could be benefit from taking it. So traumatic brain injury in 2013, could this help even now after so many years? So I would say yes, if your son is still experiencing symptoms from that brain injury. So I know people who've experienced concussions, and that post-concussion syndrome for them has lasted years. And so yes, absolutely, because as long as there's impairment, then we know that the brain isn't using fuel effectively or efficiently. We know that glucose, which is the fuel that most people have readily available, isn't being used to optimize brain function. And so what happens is the brain becomes starved. And what it then does is downregulates function because it's not getting its fuel source. Now that it's not getting fuel, it doesn't want to waste the small amounts of fuel it has. So now it downregulates, so the request or the need for fuel is even less because it's trying to use less energy at this point. And so you continue to experience effects of that sort of downregulation of function of the brain. So if somebody is still suffering the effects this many years later after traumatic brain injury, yes, absolutely. I do still always engage in giving them ketones and trying to treat that injury, even if it's this many years out, because you still want to optimize, you still absolutely want to optimize the fuel source in the brain. And again, lots of brain injury questions today. Mild concussion in a 7-year-old. So yes, lots of brain injury questions. So absolutely you can increase the ketones, which the brain absolutely can use as a primary fuel source. So I think that is it for our time today. I'm sorry if I didn't make it to all of your questions. I know I missed some of them. I can see them scrolling through, so I will try and go in and answer what I can. Hopefully I will see most of you in Louisville, Kentucky for our event at the end of the month. There will be so much great information, so when you're there, please come and say hello. Share your stories. I absolutely love hearing your stories and life changes and how the change of a ketogenic diet has impacted your life. So please, or exogenous ketones. So please come and say hello, share your experience, ask me your questions. That's one of my favorite parts of the Prove It community. And if I didn't get you to your questions, I will go back and answer what I can. Enjoy the rest of your week, everyone.